this, or why do I have this? It's okay to say, you have a special heart. You were born with a special heart. In the beginning with the preschoolers, kind of 2, 3, 4, you don't have to give a really complex description. You don't have to explain every detail. But it's okay to give them some words to be able to understand what actually is going on. If they're going to get an echo, a lot of times we'll say, well, the doctor wants to take pictures of your heart. You know, you just want to give them some idea, some reference about what exactly is happening and why is it happening. Play is a really great way to explain things. You can, have a doll and kind of explain what's going to happen to the doll. You can show on the doll. So you don't actually have to have a detailed discussion. You can just use play to explain what's going on or what to expect. Social stories for little ones, especially like 2, 3, and 4-year-olds, are a great way to communicate what's about to come. For those of you who don't know, a social story is basically a story that has pictures and then descriptions and words about what to come. So for example, if you're going to use a social story for an echo, you could have a few pages and the first page starts with, we go to this hospital, and you have a picture of the hospital. When we check in, we tell them our name, and you have a picture of a child, or you could actually take a picture of your child checking in. First, they're going to measure how much I weigh, and you can have a little picture of a scale, and you can have a child standing on a scale. So you have a story that explains step by step what your child can expect during that appointment. Social stories are a great way to prepare a kiddo for a longer appointment when there is more to expect, but also even just checkups. That's a good way to kind of talk about what's going to happen. Kids do a lot better if they know what to expect. When things are unpredictable, it can cause anxiety, and anxiety makes things much more difficult. So having some steps, knowing what to expect during an appointment for a young kiddo, but also for an adolescent, is a much better way to proceed and a much better way to decrease anxiety. And it's also okay just having explanations. So you can take that social story with you to the appointment, and you can actually say, okay, so now we're going to check in, and you can point to the story and show them what to expect. Now we've checked in, okay, what's the next step? And you can say, okay, now we're going to get weighed, and you can point to the picture that has something to do with getting weighed. So it's okay to use the story in advance, but also to bring it to the appointment and use that as a way to explain. So a kiddo knows what to expect is a good way to help manage the anxiety related to whatever is going to happen. If you start that conversation early, it's going to be a lot easier to have that conversation as your child gets older, as he or she becomes an adolescent. A lot of times, families shy away from answering questions, and a lot of times the reason they do that is because they feel anxious, because it's scary sometimes to answer some of the questions. Sometimes you don't know an answer yourself, so how are you going to answer it to a 6 or 7 or an 8-year-old? It is perfectly okay to say, I don't know. It's okay to say, I don't know, where you're not sure. It's okay to say, I don't know, when you really don't know. It's always okay to say, I don't know. But one of the things that you can do is if a child asks you something and your answer is, I don't know, you can always say, but I will find out the answer. Let's look at it together. Let's try to find out the answer. And let's ask your doctor. So your child can then see that you don't know every answer, but you're willing to ask. And that's also a good way for them to learn to ask their cardiologist or the surgeon about what to expect. So an I don't know is always an okay answer. One of the things that's really important to do too is we've got to take care of ourselves. So if we feel more anxious, if we're scared to talk about certain things, which is pretty normal, we're going to have a harder time being available to our kids. So part of our role as having kids with these congenital heart defects is taking care of ourselves. So thinking for yourself and using your own coping methods, whatever it might be. Going out with friends, reading, relaxation, to manage your own anxiety so that when your child comes to you, you actually can be ready and open to be able to answer the questions. Sometimes you're going to be caught off guard, and it is totally okay to show emotion. Sometimes families feel like, well, I have to be strong, and I can't cry, and I can't get emotional. And it's true, your child can pick up your own emotions, but there's nothing wrong with that. It's okay for them to be emotional, and it's okay for the parents to be emotional. So it's okay to show that. But it's definitely okay to say, I don't know, walk away, take a few minutes if you need to, and then answer the question if you've come up with an answer. Or if you've taken a few minutes and still don't know, It is okay to say, I don't know. One of the things that sometimes we think about when we think about kids getting older is, of course, adolescence and how much more independent they become. In the beginning, they're very dependent on us. They spend most of our time with us. But as they get older and they turn into adolescence, and adolescence really can range anywhere from 10, to 13 for the onset. They become more independent. They spend more time in extracurricular activities. They spend a lot more time at school. They spend a lot more time with friends. And friends are an extremely important part of our kids' lives. They provide social support. They give them ways to distract themselves. It's just a good thing to have. And it's really good to be able to have conversations with our kids so they can have conversations with their friends and their teachers. It's good for our kids to be able to advocate for themselves. If you were to look at some research studies that looked at kids' experiences with congenital heart defects, one of the themes that comes up is that sometimes people in their lives, like teachers, will protect them and not allow them to participate in certain activities. And it's really good for our kids to have words themselves to be able to say, well, no, wait a minute, I actually can do that. Or, no, I can't do that. They have to be able to advocate for themselves away from us. And if we talk to our kids about what's going on and what requires of them or what they can or cannot do, they'll be much more confident to then be able to advocate for themselves when we're not with them. If you have a conversation about what's happening, kids are also more open to come to you about their own frustration because they're going to have those feelings. They're kids. Just like adults, kids have lots of emotions, and having conversations with them about their medical condition allows them to understand that it's okay to talk about it, and also allows them to express their frustration to us so that we can help them figure out how to deal with those feelings as well.